Hello, and welcome to another edition of A Successful Transition from Monogamy to Open. We're going to continue our discussion on erection issues today. The other day, we talked about the physiological problems that can happen causing erections, many of which are caused by lifestyle issues such as smoking, poor diet, lack of exercise, although other medical issues such as diabetes can also be a huge cause of physiological erection issues, as well as just the aging process from venal leakage, where the veins don't hold the blood in as easily as they used to. And so sometimes that is more the issue. And we talked about that the other day. And today we're going to talk about hormonal issues. And years ago, we didn't really think about hormonal issues as much as we thought about the physiological and the psychological issues. Years ago, that really was the focus, was either that it was physiological or it was more of a psychological issue. And we really didn't pay that much attention to the hormonal issues in men. We didn't really think about the fact that men's hormones also drop as they age. And that is more of a recent phenomenon. You'll hear people talk about low T, meaning low testosterone. And we're starting to see that there are actually a lot of men who are having lower testosterone levels, even at younger ages than we would ever think of. I've actually seen men in their 30s, and sometimes when couples come in and erections or even desire issues are a problem, I often will refer them to their doctors to be tested for hormones, because I have actually seen men, even in their as young as their mid-30s, with extremely low testosterone. So it's not just men in their 40s, 50s, 60s we're seeing this. Sometimes we are even seeing this in men in their 20s and 30s. Oftentimes, it's not just erection issues that you're going to see with low testosterone. You're going to see the decreased sex drive. And erection difficulties are not just going to be when they're trying to have sex with their partner. They're also going to be not having the morning erections that men typically have. And part of the reason men have morning erections is because their testosterone level is highest first thing in the morning. And so they're also going to be having erection issues, not only with partnered sex, but with masturbation as well. They're going to have sleep disturbances. They're not going to be sleeping as well. Decreased energy, lack of strength or endurance, and even depression or lack of focus are all common side effects of lower testosterone. Now, usually with lower testosterone, I'm going to recommend people see a urologist and not just their general practitioner. And the reason being is that general practitioners, for the most part, unless they've gone and gotten specialized training, are not trained really on how to deal with hormonal issues. Some of them now are getting a little bit more because it is more common and more known, and so they are getting specialized training. But you need to do more than just the general test for overall testosterone. You need to also test for the free testosterone, which basically that's a separate blood test that needs to be ordered. And the free testosterone looks at what the body has available to use, not just what the body is producing, but what it actually has available to use. And so that's important to know when you're looking at that. And it can be tough to get the right level because we don't test men in their early ages when their testosterone is naturally at its normal level for them. And so it's hard to know what your normal is. But you don't want it necessarily too high on the scale, because then you start to see problems with aggression, and that can cause a lot of problems for people because testosterone is a very powerful hormone. And if it's not at the right level, it can cause a lot of behavioral problems in men. So the treatments for testosterone, there are a number of treatments that are covered by insurance, such as the patches, the pills, or testosterone injections. The other option that we see a lot these days are pellets that are implanted, usually in a person's butt cheek. And oftentimes, though, the pellets are not necessarily covered by insurance. Now, many people like them. They can be considered very effective. but often that's something you're going to end up paying for out of pocket. So that is all we have on hormonal issues. And then on Friday, we're going to talk about the psychological issues, as well as sometimes the difficulty of diagnosing the right thing, as oftentimes physiological, psychological, and hormonal can overlap. So that's all for today. Thank you for watching, and I will see you on Friday. Bye.